Hi, I'm Professor Dr. Ashish Davalbhakta. Today we are in Aesthetics Medispa and Advanced Aesthetics in Pune. Today's topic we are going to have on non-surgical facial rejuvenation, and we're going to explore the role of devices that help in rejuvenation. We mentioned in one of our earlier videos that there is a loss of skin elasticity, deflation, and gravity causing a downward pull. Those are the three basic components of facial aging. The loss of elasticity can be reduced or corrected by some non-surgical devices that we're going to talk about today. The skin, if it is heated to a particular temperature, something like 40 or 50 degrees Celsius in the subdermal or the superficial tissues, it causes congealing of the protein, it causes coagulation and contraction of the protein elements, denaturation of the protein elements, which are then removed by the body and replaced with a more elastic protein. So this is the basic theory on which technology has evolved, and there are so many companies now providing so many devices which help in skin tightening. One of these devices is this one here, which is based on what is called as monopolar radiofrequency. So radiofrequency is a type of a current that helps in heating the tissues without direct contact at a particular depth, and it helps in causing that rise in temperature and the congealing of the protein. So this is used very effectively for the face, and it is US FDA approved and licensed for facial tissue contractions, and usually you do a treatment for once in 4 months to 3 times, and then you go on to maintenance, and that's the way it helps. Now this is more effective, in my opinion, for delaying the relaxation or the loss of elasticity. So it is something that I would recommend to use as a preventive tool and help in maintaining your skin's tightness or tautness. You have developed the laxity, then you will find this machine helping in those whose skin is thin, wrinkled, and you will find a lot of contraction happening in them if done regularly. Brow lift, you can get a brow lift done. You can use the brow there, or you can have tightening of this tissue and sometimes the neck area. So all these tissues can be treated. Now you can use it even on the body, and I have found it very effective for post liposuction laxity of the tissues and skin. And if you use that, you will find that the skin, which otherwise tends to get loose because of the loss of fat underneath it, it shrinks and contracts, and it gives you a fairly good defined abdomen. So this is one technology, which is the monopolar radiofrequency. There are bipolar and tripolar, and all are based on the same thing, is focusing the current to the depth that you want. Keep on heating the tissues in a gentle way so it doesn't cause any pain. It comes to the degree or the level of temperature that you need, and then gives you a contraction. Another technology which is parallel to this is high intensity focused ultrasound. And here you are using ultrasonic energy, focusing it at a particular depth, again increasing the temperature and causing necrosis or congealing of the protein and helping the skin to contract. You would also experience some fat loss in those techniques, so you have to be careful when you use it, especially on the face, that you do not want those facial pockets that are very vital to shrink. So HIFU is one of the other technologies that can give you a fairly significant amount of contraction. Now of course you have to place it in perspective. None of these non-surgical will give you as much tightening as a surgical procedure can, but if your expectations are not to have a very drastic change, then you will be happy. And as I said, these are more for maintenance and prevention of the relaxation from happening than for actually curative tightening. If you are expecting a curative tightening and you want a significant amount of tightening to happen with these devices, you can get disappointed. So you have to properly rationalize your expectations. Then there are invasive tools, again based on radiofrequency, from in mode or others where you are using either surface or body tight and face tight and other devices which are partly where the radio frequency is working underneath the skin and also on the surface. So you're trying to heat the skin from both the sides, and those are more invasive devices, and they are keen to having a liposuction without actually the fat being removed. There are some devices where you can have it's called helium gas, and so you can use the gas, and Rejuvenation and other companies, they have technologies where you are sparking the gas and causing a heating in the subdermal layer and cause the skin to tighten in that fashion. So those are for some other videos, we'll talk on that, but for this I think this should be enough. Thank you very much for your patient listening.